Ladies and gentlemen, it is time for the feed, your news on NHPPA socials with Dana Fiorino.
Nearly 7 million Canadians don't have regular access to a family doctor, and yet, behind the scenes, Health Canada is quietly implementing new regulations that will reduce or even eliminate access to many natural health products. The very natural health products that more than 70% of Canadians report using for reasons such as preventing illness and staying out of our already overwhelmed waiting rooms and hospitals. The hypocrisy of reducing access to natural health options during a time of crisis is a theme that's getting a lot of attention on social media lately. So let's start by watching a video clip that really sparked a lot of conversation in the comment section. This is Sean speaking about Canada's doctor shortage on the news forum.
So Canadians take great pride in our public healthcare system, but in recent years, the system has been under enormous threat and a lot of pressure. And ultimately, it's patients who seem to be paying the price. Well, joining us now is Sean Buckley from the Natural Health Products Protection Association. Sean, welcome to the show. Julie and I were actually just discussing this during the break about there's certain policy issues that maybe a lot of Canadians don't know about.
Well, that's the thing. And this is obviously very close to my heart because of the natural health products that I use all the time. And I really wanted you to try to narrow in and give us a quick summary of what is the law that was passed last June and how is it going to affect Canadians as far as when it comes to vitamins, supplements, and their availability?
Well, there's lots of things happening. And you know what I find interesting is all three parties or main parties saying, we need to train more doctors. We're having a doctor shortage. And they're all wanting to address that in different ways. And yet we're about to, because of what the federal government is doing, lose natural health practitioners like traditional Chinese doctors and homeopathic doctors and naturopathic doctors, which is just going to aggravate things. We already don't have enough medical doctors to go around.
As Sean said, we already don't have enough medical doctors to go around, and it's just going to aggravate things even more. The everyday consumer who purchases supplements like vitamins, minerals, herbs, homeopathic remedies, protein powders, probiotics, the list goes on. They're doing a really positive thing for themselves and for society by taking care of their bodies. They're preventing illness, and they don't need to go to the doctor or the hospital nearly as often because of all of the hard work that they're doing at home, in their kitchen, and at the gym, for example. For these people, the supplements they rely on are going to get more expensive, and some might just disappear entirely as companies struggle to get products licensed. Perhaps they decide to discontinue products for financial reasons, or in the worst case scenario, entire companies go out of business and all of their products are gone as well. Consumers will have a much different experience in the supplement section at health food stores, possibly realizing that they can no longer afford or no longer find their regular supplement routine. So let's turn our attention towards natural health practitioners because this is seriously going to affect them too. Traditional Chinese medicine practitioners, homeopathic doctors, herbalists, holistic nutritionists, and naturopathic doctors. These practitioners, they don't just use a couple of products. They often rely on thousands of products and specific formulas to offer personalized care. If those products become unaffordable or unavailable, their practices will become incomplete and potentially impossible to continue. So let's roll the video of Sean talking about this on the news forum.
Health Canada is planning on bringing in new fees that are going to make it uneconomic for many of the main suppliers to keep their licensed products on the market. So, for example, both for traditional Chinese doctors and homeopathic doctors, the number of products that they need to effectively practice is measured in the thousands. And the main distributors have said with these new fees that Health Canada has said they're bringing in this calendar year, that they're basically going to go out of business. Well, what are people going to do when they go to a traditional Chinese medicine doctor, for example, and the doctor has no more natural remedies to treat you with?
A popular comment under this video reads, "Learn how to heal yourselves. Medicine grows all around you. Learn how to heal yourself and your family." Another comment simply says, "Grow your own medicine." And another person said, "On the bright side, people are learning how to naturally treat at home and are bypassing the doctors and pharma." Somebody else replied to that comment and said, "Can't treat with no products," which is exactly what I was thinking. A lot of people seem to share this sentiment of growing your own medicine and learning to heal yourself. It's been a consistent theme in our comment section for years, and it's a great message, but I think we're missing the bigger picture. To me, that sounds a lot like admitting defeat and accepting that Health Canada is just going to put a whole bunch of Canadian companies out of business and completely decimate the entire natural health industry, including manufacturers, retailers, and practitioners, but that it's okay and we're supposed to just accept it because we should all be going outside and growing our own herbs. That's what I hear from this type of comment. It also is completely zeroed in on the medicines that can be grown and foraged, such as herbs and mushrooms. It forgets about the people that can't create their own medicine. Maybe they're too sick. They don't know how. They don't live near what they need. They don't know what they need. There are a number of reasons why someone might choose to go to a health food store for their supplements, and we should be free to choose that without unnecessary government interference. Another thing to keep in mind is that Canada's natural health industry is full of products that have been expertly formulated with specific combinations of vitamins, minerals, herbs, and adaptogens, for example, created by companies that a lot of times started with a personal journey through illness and recovery. We need to protect those companies, and we need to protect all of the people who are relying on the innovative products that they create, rather than just suggesting everyone needs to go outside and create their own medicine. This is really a sentiment that I hope we see less of over time. On another note, not everyone is willing to roll over and accept the loss of our natural health products. One popular comment reads, "Traditional Chinese medicine has been available for over 2,000 years. Imagine Health Canada thinks they can stop that for us." Again, that's exactly how I feel. So your task from me is to check out Sean's latest article published in Vitality magazine. It's titled "Health on the Hill. Health Canada is about to turn the doctor shortage into a doctor crisis." Read it, and if the message sparks something in you, I encourage you to share it to really help us reach more people and get more done.
Wow, that was good.
Amazing.